The third tool we'll utilize in the Ultimob system is a concept called joint repositioning. Now, I'm sure most of you have heard of foam rolling and stretching before, but joint repositioning is usually a new concept to most people, so let's talk about it a little bit. Well, when we talk about dysfunction in the human body, practitioners especially like to think of it in terms of musculature. Simply put, we like to think that, oh, this muscle got short, this muscle got tight, it's not extensible, limiting range of motion, it has trigger points. But point being, we think in terms of the muscles, right? Well, a joint can contribute just as much to dysfunction. When we talk about a joint, it's made up of two articular surfaces, right, the bones, and those articular surfaces move across one another. Now, what joints have a tendency to do is become malaligned. So that joint, one surface will get translated one way or the other, one side or the other, and essentially those surfaces will not be aligned properly anymore. Now, when we have that malalignment, we go through a range of motion, a couple of things happen. Well, number one, those joint surfaces don't articulate nearly as smoothly, okay? Number two, we'll get asymmetric forces going across one side of the joint or the other. Then number three, when we get offset in a joint, when that malalignment happens, there is a propensity for some of the nerves that are associated with that joint to become irritated or impinged. That also hurts. So essentially, when we talk about joint repositioning, we're talking about introducing external forces into a joint to help create a proper position and regain the alignment of that joint. By doing so, we get better articulation and we negate all those bad things I just talked about. Now, when we talk about joint repositioning in our practice, we're going to use it mainly for pain resolution and performance, okay? We kind of touched how those concepts are going to be worked on, so we'll wait to see how it applies when we get into the actual sequences. So then the final question is, what are we going to use to reposition joints? And that, within our Ulti-Roller kit, is going to be one tool, the Monster Band. Now, the Monster Band being made of rubber, it's a little bit more forgiving when we're going across different joint surfaces and our skin, okay? And then number two, given the elasticity of this band, we can anchor one side of it to a wall, to anything that is stationary, and then we can use the other side to create that external force that helps reposition the joint to be in better alignment. So that is what we will use, is the Monster Band. Now that we kind of understand a general overview of joint repositioning, please go below to the step-by-step schema of how we'll apply that to our body, and then we can see the specifics of it within the mobility sequences below that.